India reported a daily increase of 3,60,960 COVID cases. That's the most in a day yet. Death toll had crossed 2 lakhs with 2,01,187 with 3,293 fatalities being reported, and that's the first time it crossed the 3,000 mark. Now, as people continue to struggle for oxygen, medicines and hospital beds. Now, 1 lakh portable oxygen concentrators will be procured from the PM CARES Fund. This was announced yesterday. 500 more PSA oxygen plants based on technology developed by the DRDO sanctioned under PM CARES in 5 months. The oxygen concentrators and PSA plants will greatly augment the supply of oxygen near the demand clusters, is what has been announced. Now, if we focus on Uttar Pradesh first, the UP Chief Minister has said that a case will be filed against those who spread rumours about any lack of oxygen. But people are coming from Delhi, Meerut, Bulandshahr to fill oxygen cylinders at Ghaziabad's oxygen plant. See this ground report from Ravish Ranjan Shukla.
ये पर्चा उन्होंने दिया कि गैस लेकर आओ। हर 3-4 गैस स्टेशंस के पास गए हैं लेकिन नहीं मिल रहा है। यहाँ पे खड़े हुए हैं। ये वंतिका का पर्चा जी पूरा।
Hundreds of people waiting for hours in the hot sun, hoping to refill oxygen cylinders in Ghaziabad steel compound. 500 people have been given numbers, but only 50 cylinders filled in the last 6 hours. Some are from Delhi, some from Meerut, all slowly losing hope as they wait and wait.
कल शाम से हॉस्पिटल में ऑक्सीजन नहीं है। हॉस्पिटल 2 बार बोल चुका है अपना पेशेंट ले जाओ या ऑक्सीजन ले आओ। सुबह 7 बजे से यहाँ पे खड़ा हूँ।
कहाँ पे? गाजियाबाद में।
मेरठ से आया हूँ मैं।
हमारे जी पड़ोसी हैं आंटी जी, उनको कोरोना हुआ है। वो उनको एक मिनट भी के ऑक्सीजन नहीं उतार सकते हैं।
एक मिल जाए तो माता जी के थोड़ी देर के राहत मिल जाती है, बस इतना। हम इंदिरापुरम से आए हुए हैं।
While police watch over the queues to prevent any fights, people waiting say the VIPs are taking oxygen out of turn.
5 घंटे हो गए खड़े हुए हैं। यहाँ से VIP ट्रीटमेंट चल रहे हैं यहाँ पर, which is not nice. ऑक्सीजन अगर आप फ्री में दे रहे हैं तो फ्री का मतलब चैरिटी वर्क है। इसका मतलब ये नहीं है कि आप मतलब भीख दे रहे हैं किसी को।
If there is such a shortage at Ghaziabad filling plant, one wonders what the situation is in remote areas of the state. Ravish Ranjan Shukla from Ghaziabad, Revati Hariharan for NDTV.
And there was an outcry at Agra's private hospitals yesterday and earlier this week due to a lack of oxygen. On one side, there were people jamming roads as an outrage, while on the other side, there was a hue and cry outside hospitals, according to relatives and their allegations. A lot of people have died due to the lack of oxygen and that there hasn't been any official investigation regarding it. Now, some stock of oxygen has reached Agra, and according to the administration, there would be a significant amount of oxygen reaching Agra very soon.
The city of love has come to this. Despite the UP Chief Minister's claim that there is no oxygen shortage in the state, a lot of private hospitals in Agra are running low on oxygen, and worried relatives have gathered outside.
लास्ट मूवमेंट में बताया जा रहा है, लास्ट मूवमेंट में बिल्कुल जिन लोगों को सिलेंडर हैवी है ना, उनको ही मौका नहीं दिया जा रहा है कि वो फ्लोर पर
There are many mourners at Agra's Shahid Nagar Upadhyay Hospital. Ansh lost his mother even after managing to get a remdesivir injection for her from the black market for 40,000 rupees.
डॉक्टर है, उसका लाइसेंस कैंसिल करवाओ सर, मेरा आपसे निवेदन है सर। मैं उषा गोयल, मेरी मम्मी चली गई इस हॉस्पिटल वालों कड़ी से, इसका लाइसेंस कैंसिल करवाओ। मेरी मम्मी 21-22 तारीख से एडमिट थी।
यहाँ पे कोई ऑक्सीजन नहीं है। सुबह से हम लोग कल से इनफैक्ट भाग रहे हैं। कल सुबह से 6 बजे से हम लोग सब लोग परेशान हैं। यहाँ पे कोई टैंकर कुछ भी नहीं है। हमारे मरीज मर रहे हैं रोज।
Ramveer Yadav has been in hospital for the past 16 days. His relatives are worried.
आपका क्या नाम है?
सरकार की नौकरी की है
बताइए।
और छोटे छोटे बच्चे हैं, हम कहाँ ले जाएं?
कहाँ के रहने वाले हैं?
वो तो उनका बेटा पुलिस में नौकरी कर रहा है, वो नहीं आ पा रहा है इलेक्शन की ड्यूटी करके।
कहाँ के रहने वाले हैं?
शुकाबाद के
कितने दिन से
ड्यूटी में लगा हुआ है, वो
कितने दिन से
Agra needs 37.5 tons of oxygen. On Monday, it got 3.5 tons from a Mathura refinery, and on Tuesday, another 10 tons.
जैसा आप पीछे देख रहे हैं, जो हमारे 6 मेजर हॉस्पिटल्स हैं जिनके पास लिक्विड ऑक्सीजन होता है, यहाँ से हम उसको भेज करके उनके टैंक में भरवा देंगे अभी। इसके अलावा एक और हमारी 16 MT की ट्रक जो है मोदी नगर से पिछले 2 घंटे पहले निकल चुकी है स्टार्ट करके।
देश में इसके पहले कभी भी इंसान की जान बचाने के लिए इतने बड़े पैमाने पे ऑक्सीजन की जरूरत नहीं पेश आई थी। भले उसके लिए पर्याप्त ऑक्सीजन हो, लेकिन उसका ट्रांसपोर्टेशन एक बहुत बड़ा मसला है, जिसकी वजह से बड़े पैमाने पे उसकी किल्लत बरकरार है। आगरा में नसीम और कैमरामैन राजेश गुप्ता के साथ कमाल खान, NDTV इंडिया।
Now in Gujarat, Surat is facing an acute oxygen shortage. Many hospitals, including the civil hospital, earlier said they wouldn't take any more patients if the oxygen supply wasn't restored. According to the state government, there are around 52,000 patients under treatment on oxygen support in the state, and the entire state gets 1,000 million tons of oxygen. There you can see the situation at the hospitals, and more ambulances also lining up at the crematoriums also. There are massive numbers of people arriving to cremate their loved ones. Let's go across to Purva for more on this story. Purva, what is the situation now? Earlier hospitals had said they weren't receiving enough supplies. Has something been done? Has it been restored? Purva, can you hear me?
Gaji, if you can hear me?
Yes, go ahead. Tell us what the situation is like now.
Yes, so as I was saying, in Surat there are 2 main hospitals. One is the civil hospital and another one is a corporation-led hospital. And the doctor, in fact, Indian Medical Association also says that Surat requires about 230 metric tons of oxygen is required, but Surat is receiving about 150 metric tons. So they have been demanding that this needs to go up, because there are already 4,000 odd patients in other private hospitals. About 400 odd private hospitals are there in Surat, and there are patients in private hospitals as well. The private hospitals have stopped taking new admissions, and now, in fact, yesterday even the civil hospital have stopped taking new admissions. And for civil hospital also, let me tell you that all the rural areas of Surat, patients are being sent to Surat Civil Hospital from the peripheral areas as well, considering the primary healthcare center is not very equipped to handle the number of patients from the rural areas, and they are also sent to the civil hospital. And all those patients who are coming to civil hospital, most of them require oxygen and ventilators. So civil hospital has said that we already have patients and not enough oxygen with us, and they have stopped taking admissions. And also the collector has been demanding for a few days now that there is a problem, a shortage of oxygen, and this needs to go up. But right now, Surat is still receiving about 150 metric tons of oxygen when the required number is 230.
All right, Purva, thanks so much for joining us with those details. And let's now focus on Karnataka. And Karnataka reported a new all-time record on Wednesday with 39,047 COVID cases in a 24-hour period, taking the total caseload to 14.39 lakh. Capital city Bengaluru alone accounted for 22,596 of the total number of cases, even as its health infrastructure is bursting at the seams amid the deluge of cases. Karnataka has now over 3 lakh active cases, of which 2 lakh are in Bengaluru alone. Chief Minister BS Yediyurappa has appealed to people to abide by the lockdown norms to break the chain of infections. And in Mumbai, over 6 lakh people are in home isolation, and that figure is more than 42 lakhs when it comes to the state. Patients in home isolation are now struggling to get oxygen and medicines. Here's a report.
This 72-year-old patient is COVID positive on oxygen support at home, with oxygen sourced from a social organization after multiple requests.
We were looking out for an oxygen cylinder for my Masaji, who is 72 years old. It took us 3 to 4 hours where we were only getting redirected from place to place and number to number until I got the number of Nesh, which in one call, in 2 rings.
Hatim Dodawala is looking for beds for his 75-year-old father-in-law. They've given him oxygen at home till they can find a bed.
डॉक्टर ने बोला कि अभी इनको पहले ऑक्सीजन दो, तो ऑक्सीजन से अगर कंट्रोल हो जाता है तो एडमिट करने की जरूरत नहीं, वैसे हॉस्पिटल में जगह भी है नहीं. बहुत ज़्यादा तकलीफ हुई है ऑक्सीजन ढूंढने में, मिल नहीं रहा है और जहाँ मिल रहा है वहाँ बहुत लाइन भी लगी है और परेशानी हो रही है.
Anjum Syed is now COVID negative but needs oxygen support at home after discharge from hospital. Getting an oxygen cylinder is a struggle.
ये मेरी अम्मी है, अंजुम सैयद. ये ऑक्सीजन इनका चालू है. ये हमने प्रोक्योर किया है नेश से, जो एनजीओ फाउंडेशन है उनसे. ये नहीं होता तो बहुत दिक्कत होती, क्योंकि कहाँ पर भी पूरे बॉम्बे में कहाँ नहीं मिला. ये कोविड पॉजिटिव थी बट घर में लेकर आके इनको ऑक्सीजन की ज़रूरत है करके रोज डेली का एक सिलेंडर लग रहा है.
There are lakhs of patients who are recovering at home with basic oxygen support due to lack of hospital beds.
यहाँ हम लोग थोड़े थोड़े कुछ सिलेंडर रख के लोगों की सेवा करते हैं, जो खास करके उन लोगों की जो होम आइसोलेशन कर रहे हैं या जिनको हॉस्पिटल ने जल्दी छोड़ दिए कि भाई आप ये बाकी का इलाज आप घर पे ऑक्सीजन का करवा लो. बहुत सारे पेशेंट जो होम ट्रीटमेंट करते हैं वो गुजर भी जाते हैं. किसी को तो हम या वो ऑक्सीजन लेके जा रहे हैं तब तक वो बंदा यानी लाइक ही पासेस अवे.
कई मेरे पास ऐसे मैसेज हैं कि लोगों ने 2-2 घंटे ट्राई किया कि कहीं बेड मिल जाए ताकि जो उनके मरीज़ हैं उनको वहाँ एडमिशन करा दें, उनकी जो मरीज़ है वो ठीक हो जाए, लेकिन कहीं भी उन्हें बेड नहीं मिला और आखिर में उनके जो परिवार का जो व्यक्ति था उसने दम तोड़ दिया.
In Maharashtra, 42,64,936 people are in home isolation. In Mumbai, that figure is 6,28,854 people who are quarantined at home. Every 5 out of 100 people in the city of Mumbai are receiving treatment at home. Doctors advise correspondence at regular levels with doctors and tests like a chest CT scan done on the 7th day so that the severity of the disease can be detected on time before the patient deteriorates. In Mumbai, with Pooja Bhardwaj, Saurabh Gupta, NDTV.
Now, with a fire at a hospital in the Mumbai area of Thane district adjoining Mumbai, questions are being raised about the fire's safety at hospitals. At least 44 patients have died in 5 major fires at hospitals since January in Maharashtra.
The latest hospital fire in Maharashtra, the 5th major hospital blaze in 4 months. 4 patients died after a fire broke out at the Prime Criticare Hospital, a private hospital in Mumbai, around 28 kilometers from Mumbai. The cause of the fire is not clear yet. A high-level inquiry has been ordered. In all, 44 people have been killed in Maharashtra's hospital fires this year, so why have no lessons been learned? After 10 newborns died in a fire in Bhandara in January this year, an inquiry report was submitted. The action? 3 hospital officials were suspended, 1 transferred, and the contract of a doctor and 2 nurses terminated. A short circuit caused the fire, but timely action which could have avoided the mishap was not taken by officials. No arrests have been made in the case registered after the Bhandup Hospital fire, as investigations are still on. An FIR was lodged against the owners of Dreams Mall and directors of Privilege Healthcare Services Private Limited, which owns the hospital. The mall, where it was housed, had been warned that firefighting systems were grossly inadequate. Here too, a short circuit is believed to have been the cause. On April 9, 4 lives were lost after a fire broke out in the ICU of the Welltreat Hospital in Nagpur that was treating non-COVID patients. Officials said the blaze had erupted in an AC unit of the ICU located on the 2nd floor of the hospital. No action against anyone yet. The cause of the fire is once again a suspected short circuit. After 15 ICU patients died in the fire at the Vijay Vallabh Hospital in Virar near Mumbai last week, the police arrested the CEO and the Chief Administrative Officer of the hospital on Sunday for alleged negligence and violation of fire safety norms. Shockingly, officials had told NDTV on camera that a fire audit had been done and systems had worked, while the police now claim otherwise.
डॉक्टर दिलीप शाह, डॉक्टर शैलेश पाठक, इनको अरेस्ट किया है. माननीय वसई न्यायालय ने इन दोनों आरोपी की 1 दिन का पुलिस कस्टडी रिमांड मंजूर किया है. इन्वेस्टिगेशन में जैसे जैसे मुद्दे सामने आएंगे उस हिसाब से हम कार्रवाई कर रहे हैं.
Fire audit of this hospital, Vijay Vallabh Hospital, was done about a month and a half back. It was fire compliant, but still, why the fire occurred, we will have to ascertain it.
The spate of fires has caused concern in the administration as hospitals are running to full capacity during the pandemic. In Mumbai, Saurabh Gupta, NDTV.
Now, nearly 1.33 crore people applied for vaccinations on Wednesday as the government's dedicated website, CoWIN, opened for registrations on Wednesday. Those between 18 and 44 years of age can get the COVID shots from the 1st of May, that's Saturday. Though the new signees are not likely to get coronavirus vaccines when they become eligible for the jabs due to the supply constraints. After initial glitches, the CoWIN site was getting almost 27 lakh hits a minute, according to government sources. Appointments will be based on slots made available by states and private vaccination centers. But the worry is when the states will have enough vaccines for the next stage of the vaccination. So if we take you through what happened yesterday, first at 4 p.m. when the registrations opened, this didn't work for many who got an error message saying CoWIN server is facing issues. Please try later. However, Arogya Setu, the union government's app for contact tracing and dissemination of medical advisories to contain the spread of COVID, then tweeted saying CoWIN portal is working. There was a minor glitch at 4 p.m. that was fixed. 18 plus can register.
I just want to, tell your viewers through your platform that making registration is one part, but getting an appointment will depend on the kind of facilities when they come up on this platform and when they start vaccination. So it may happen because this is to come, the program has to happen from 1st of May. And there may be situations where some states may come on board on 1st of May, some may come later, or some hospitals may come on 1st of May and some may come later. Therefore, the visibility into the, bookings or the vacancies will be available as and when those entities come on board. So people should have patience in the sense that they can continue looking for the vacancies. And we are creating a separate utility, separate, search facility where you can see as to which are the vacancies which are available.
Now, the Serum Institute of India reduced the price of Covishield vaccine for states to 300 rupees a dose from 400 rupees earlier. The Chief Executive Officer Adar Poonawalla said the move follows criticism over the company's sharp increase in price for the government and private hospitals. Poonawalla tweeted, as a philanthropic gesture on behalf of the Serum Institute of India, I hereby reduce the price to the states from 400 rupees to 300 per dose effective immediately. This will save thousands of crores of state funds going forward, and this will enable more vaccinations and save countless lives. With that, time for us to slip into a short break. Coming up on the other side, polling taking place in West Bengal amid the increase in coronavirus numbers. We'll get you all the very latest. Welcome back. Bengal is polling for the 8th and final phase of the longest ever assembly elections anywhere in the country. For 33 days, Bengal has been on vote mode amid a COVID surge that has killed 77 people in the state in the last 24 hours and infected over 16,000 people. In fact, 4 candidates have died of COVID. Several others are COVID hit, and the wife of a COVID victim has accused the Election Commission of murder. Amid all this, 35 seats polled today. Well, let's go across to Monideepa for more. And Moni, give us more details about the seats that are polling and also relief for everyone in the state as this long-drawn election is finally over today.
Yes, indeed. I mean, it's, the whole excitement and the joy of a vote and then looking forward to the elections. Honestly, that has been overshadowed by the COVID surge in Kolkata, in Bengal, and of course, in the rest of the country, Delhi, Maharashtra, to start with. But nevertheless, voters are out. I'm in Kolkata today, though there is voting going on in several districts as well, Birbhum, Malda, Murshidabad, as well as, remember, Sheetalkuchi, the place where there was firing on the 10th of April that left 4 people dead. Sheetalkuchi is also voting today. So actually a total of 36 seats going to the polls. Now, in the meantime, the COVID impact. Let me show you lines of people everywhere. In Kolkata, though, in the last phase, polling percentages have been down. But people are out in strength, determined to vote. However, the COVID impact of the elections being felt every day. You know that yesterday a woman, Nandita Sinha, she filed a complaint against the Election Commission itself, accusing it of murder because her husband, Kajal Sinha, died during the elections of COVID. He was the Trinamool candidate from Kharda. Other than that, an independent has passed away also from COVID up in Malda at a seat called Vaishnav Nagor. But because he's an independent and not representative of a recognized political party, that vote is continuing today. So Shamir Ghosh, the fourth victim candidate in the elections of COVID. Yet another very prominent leader, Shri Rupa Chaudhary. She is the BJP candidate from also Malda's English Bazaar. She has been admitted to hospital yesterday with COVID and is under treatment. So COVID has had a huge impact. As you can see, everybody masked up to come and vote. Other than that, very key phase, this 35 seats, 36 if you count Shital Kuchi. Again, 2016, 2019, assembly elections, parliamentary elections, good for the BJP. They increased their vote share, they increased the number of seats in which they were leading. What will they get this time? That is the big question. But really today, with exit polls coming in this evening and election results on Sunday, not much of a weight left to that crucial question. Who is winning? Back to you.
All right, Monideepa, and do stay safe as you cover this last phase of elections in West Bengal. With that, time for us to slip into a short break. More news on the other side. Stay with us. Welcome back. Now, COVID restrictions are hampering wedding plans in Haryana. The new restrictions have increased worries for people who cannot defer the marriages and are now making rounds to offices of the district administration for permissions. According to authorities, hundreds of applications seeking permission for marriages have been received since the restrictions were imposed. Moreover, the restrictions, especially night curfew, has cost the owners of marriage palaces heavily as most marriages were fixed for night and have now been cancelled or shifted to villages due to the fresh guidelines and night curfew.
As COVID cases rise in Haryana and with prohibitory orders in place, wedding celebrations have been hit. With only 30 guests allowed at indoor ceremonies and 50 for outdoor, people like Abhijit Singh are shifting venues from Delhi to Narwana town and then to his native village in Jind district.
गांव में हमें अपनी शादी शिफ्ट करनी पड़ी और जितने हमने पैसे दिए थे काफ़ी जगह पे जो रिटर्न के लिए भी इशू रहता ही है उस चीज़ का, जितने गेस्ट थे उनको मना करना पड़ा, वो भी 2 दिन पहले 1 दिन पहले। हमारा तो गांव पास में ही था, हम एडजस्टमेंट कर ली, घर वालों के साथ शादी कर ली, लेकिन काफ़ी लोगों को काफ़ी दिक्कतें आई होगी।
Pawan Shastri had to reprint the invitation cards as well as change the timings.
कोरोना की वजह से सरकार की जो कंडीशनें थी उनको देखते हुए मैंने जो कार्ड बांटे थे 500 की कंडीशन आने की वजह से मैंने कुछ रिश्तेदारों को और यार दोस्तों को शादी में आने से मना ही करना पड़ा। दूसरी परिस्थिति ये आई कि मेरी रात की जो शादी थी रात को कर्फ्यू लग गया और कर्फ्यू लगने की वजह से मेरी रात की शादी जो वो कैंसिल हो गई।
Permissions for weddings is also a big challenge for officers.
Closed areas वहाँ पे हम 30 लोगों की परमिशन दे रहे हैं और जो हमारे ओपन एरिया हैं, ओपन स्पेस में जो फंक्शंस ऑर्गेनाइज होंगे वहाँ पे 50 लोगों के रिस्ट्रिक्शंस।
Meanwhile, the Home Minister has suggested people to finish ceremonies before the night curfew.
फिर सब ये माना जाए कि 4 घंटे में लोगों को कार्यक्रम निपटाना होगा।
मजबूरी है, इतना कोरोना फैला हुआ है, उसको रोकना तो है ही है।
As COVID cases surge in Haryana, the government has not yet banned gathering in marriage ceremonies or during funerals. But it is now the responsibility of every citizen to ensure that even during such gatherings, COVID-appropriate behavior is adhered to. With Mohammad Ghazali in Chandigarh, Rohit Wellington for NDTV.
And harrowing images are playing from across the country showing mourners lining up outside crematoriums and rows of funeral pyres. In many areas, the pictures contradict the official numbers that have been released by authorities in terms of number of dead. In Delhi, in fact, fresh cremation areas have been set up in parks to deal with the huge number of deaths that have been taking place over the last couple of days. In other cities and towns as well, there are reports of endless lines at crematoriums and a token system as well going into the hundreds. With thousands of people dying of corona every day in the country, the situation is so bad there's no one to cremate some of the dead. Pritam Singh and his colleague in Delhi are cremating those who died at home from corona, and there is no one to take them to the Shamshan. Here's a report by Saurabh Shukla.
फर्स्ट फ्लोर से उतारनी है, हम 2 लोग हैं, सोसाइटी वालों को बोला हेल्प करा तो वो डर रहे हैं, क्या हमारे घर में बाल बच्चे नहीं है, 73 साल की मदर है मेरी, 2 लोगों से नहीं उठ पाएगी, 2 लोगों से बॉडी कहाँ उठेगी सर, फर्स्ट फ्लोर से नीचे उतारनी है, तीसरा बंदा चाहिए। हमारे को ये महसूस होता है कि यहाँ पे किसी आदमी की डेथ नहीं है, इंसानियत की डेथ हुई है, बिल्कुल इंसानियत खत्म हो गई है।
Back-breaking work, heartbreaking scenes. Pritam Singh and Devender in northwest Delhi collecting an elderly man's body for the last rites. 70-year-old A.N. Yadav died of corona last night after failing to find a bed in any hospital. His family is unable to perform the last rites as even his wife has COVID.
कोविड है मैम, घर पे सिर्फ आपकी मदर है, उनके साथ कोई है?
नहीं, अभी तो फिर सिस्टर भी है उनके पास ही।
और मदर सिर्फ अकेले हैं घर पे आपकी? मैम क्या बेड नहीं मिल पाया सर को कल?
हाँ, उनको बेड नहीं मिल पाया, हम लोग 2 दिन से परेशान हो रहे थे बेड के लिए।
As Pritam and Devender bring the body down, they have no help from the neighbors.
क्या सोसाइटी में किसी ने लिख के दिया है कि किसी और के घर पे कोरोना से डेथ नहीं होगी, किसी को सर्टिफिकेट मिला है?
Pritam and his team have so far cremated about 322 COVID patients. They don't charge the family. They even use their own ambulance.
हमें ज़्यादा जो कॉल्स आती हैं वो लोग की वो घरों से आती है जो अनक्लेम्ड हैं, जो गवर्नमेंट के किसी भी खाते में नहीं है कि कितनी डेथ्स हो रही हैं, तो हमें वहाँ से कॉल्स ज़्यादा आती है कि जो घर में जाके कोई भी उसकी बॉडी नहीं उठा रहा, ना एम्बुलेंस वाले जा रहे हैं, ना डिपार्टमेंट्स से कोई जा रहा है, ना एमसीडी से जा रहा है, ना किसी हॉस्पिटल से जा रहा है, तो प्रशासन भी इस पर कुछ नहीं कर पा रहा है, तो वो जाके वो बॉडीज हम उठा के क्रिमेशन के लिए लेके आते हैं।
A businessman and a photographer, Pritam and Devender from the NGO United Sikh also take bodies from Muslim families to cemeteries. This is Pritam's message.
जो हमें गुरु साहब ने सिखाया, हम उसी पद चिन्हों पे चलने की कोशिश कर रहे हैं कि मानव जो है अवली अल्लाह नूर पाया कुदरत के सब बंदे, एक नूर ते सब जग उपजया कौन भले को मंदे।
Nobody has seen God, but today in this pandemic, people like Pritam, people like Devender, they are God for those who cannot cremate their own loved ones due to health issues because they cannot. For them, they are no less than a God. In New Delhi with Ashok Mahalle, Saurabh Shukla for NDTV.
Now, crematoriums in Gurugram next to Delhi are also running short of space. The Rambagh crematorium in Madanpuri has space for cremations of 30 bodies in a day. But yesterday was the 3rd consecutive day that they've run out of space and are cremating bodies in the adjacent parking lot. The crematorium used to shut at 6 p.m. usually, but now runs round the clock. Residents who have houses next to the crematorium say they have never witnessed such circumstances. NDTV Sukirti Dwivedi reports.
We are currently at the Rambagh crematorium in Gurugram. At least 90 bodies were cremated at the crematorium right next to us over here. On Monday, 60 bodies were cremated yesterday, and today 30 dead bodies have already been cremated in the main area or the main premises of the crematorium, but they've run out of space, and that is why you can see in the main area the funeral pyres are still visible. These are bodies that have been cremated there through the day. At least 30 bodies can be accommodated in this entire area, but they've run out of space, and that is why for the 4th consecutive day they have had to set up funeral pyres even in the adjacent parking lot, something that has been never done here. This crematorium usually runs only till 6 p.m. and their services stop post that on a usual day, but because of the COVID dead bodies that have been coming in, there are cremations that are taking place here day and night, and this entire crematorium is in a residential area. Everywhere you look, there are houses, hundreds and hundreds of houses with families in them, women and children, all of them, and this entire smoke 24 hours from these crematoriums is also causing difficulty for the residents who live here.
मेरा नाम शम्मी है और मैं पिछले 25 साल से यहाँ रह रहा हूँ, लेकिन मैंने आज से पहले कभी ऐसा नहीं देखा। और यहाँ पर जब चिताएं रात तक जल रही हैं, पहले तो 6 बजे तक ही बंद हो जाता था, लेकिन अब चिताएं रात तक अभी जैसे देख रहे हैं आप सारी सेटअप हो चुकी हैं। उसके बाद थोड़ी देर बाद इनमें अग्नि दी जाएगी और उसके बाद ये ट्री दिख रहा है जो आपको ये सारा पूरा रेड हो जाता है, जैसे इसको ही जला रखा है सबने। धुआं ये सारे रेजिडेंशियल एरिया में आता है हमारे यहाँ, छोटे छोटे बच्चे हैं यहाँ पर।
Things difficult for anybody living in Delhi or the NCR region at this point of time. A struggle for medicines, a struggle for hospital beds, a struggle to say even a proper goodbye, a respectful proper goodbye to your loved ones. And here in crematoriums, the staff is overworked, the families who live next to the crematorium inhaling the smoke day and night. In Gurugram, with camera person Ashwini Mehra, this is Sukirti Dwivedi for NDTV.
And two heart-wrenching photos from Uttar Pradesh have brought home the situation of COVID-hit families in rural areas. One of the photos being circulated shows an elderly bearded man carrying the body of his wife on a cycle and another shows the bicycle having fallen down and the body sprawled across it. This is after villagers in his village refused to allow him to cremate his wife there.
In Jaunpur, Uttar Pradesh, Tilakdhari Singh slumps near his wife Rajkumari's body. Their village didn't allow the COVID victim's funeral. No way out, he put his wife's corpse on his cycle for her funeral by a river. But Tilakdhari couldn't make it alone. The UP police passing by intervened and organized the last rites. By the river, Tilakdhari bid his 50-year-old wife farewell. India's second COVID wave isn't sparing villages. The Prime Minister has voiced fears of the pandemic spreading to rural areas.
All right, with that, time for us to slip into a short break. Coming up on the other side, how the United States is sending supplies worth more than $100 million to India. Welcome back. The United States is sending supplies worth more than $100 million to India to help it fight a surge of COVID cases. The White House said in a statement on Wednesday the supplies, which will begin arriving today and continue into the next week, include 1,000 oxygen cylinders, 15 million N95 masks and 1 million rapid diagnostic tests. The United States also has redirected its own order of AstraZeneca manufacturing supplies to India, which will allow it to make over 20 million doses of COVID vaccine, according to the White House. Just as India sent assistance to the United States when our hospitals were strained early in the pandemic, the United States is determined to help India in its time of need, is what the White House said in a fact sheet outlining the aid. Well, our top story is Karnataka, and Karnataka reported a new all-time record of 39,047 COVID cases in 24-hour period, which takes the total caseload to 14.39 lakh there, and capital Bengaluru alone accounted for 22,596 of the total number of cases. Well, let's go across to Maya for more on the situation there in Karnataka. And Maya, this is even as there's a 2-week lockdown in place right now, but even so, there are reports of the health infrastructure bursting at the seams.
Almost 40,000 new cases within a 24-hour span. It's almost impossible for any health infrastructure to actually cope with that. And this is despite the fact that Bengaluru is known for its fantastic hospitals, its fantastic doctors and medical staff. This is a medical hub of the country, and it's finding it so difficult to cope with these massive numbers. Nearly 40,000 in the state, with 328,884 active cases in the state. Bengaluru alone accounting for 224,152 cases, active cases in the city of Bengaluru. And we're talking about 842 COVID patients in ICUs in the city. Now, this means, of course, that patients and their family members are struggling to find an ICU bed despite the health infrastructure in the city, despite all of those big specialty hospitals, despite the many government hospitals. They're still struggling to find an ICU bed. You'll find even the official link for government quota hospital beds. Most of the hospitals are showing no beds available for ICU patients. There is, of course, a struggle for oxygen and medication as well. The state government, though, is continuing to insist that there is enough oxygen, there is enough medication. But the fact on the ground is that many people are still making appeals to try and find an ICU bed for the people that they love. There is a 14-day shutdown in the state that began day before yesterday night. Yesterday was the first full day of shutdown. There are many restrictions in place, like there is no intrastate or interstate travel unless it is an emergency. Although people are being encouraged to still go for their vaccinations and also for testing for COVID. Although without public transport, it has been a challenge for some. Taxis and autos can ply only in the case of an emergency. No bus transport between the state either. Trains and planes which have been earlier scheduled, most of them are still arriving, and you can use your ticket for that as a movement pass. Now, of course, agricultural, manufacturing and industries are actually allowed to work, and yesterday evening the Karnataka state government also permitted garment factories. This is an industry which employs thousands. Garment industries were allowed yesterday to work with up to 50% capacity in the state. That was a decision taken yesterday in modification of the earlier shutdown regulations. Essential supplies only between 6 a.m. and 10 a.m. A lockdown in Karnataka as it battles with a record spike in cases.
All right, Maya, thanks so much for joining us. So that's the situation in Karnataka. Now in Maharashtra, Maharashtra reported the highest ever COVID deaths, 985 in a 24-hour period. 63,309 new cases and 985 COVID deaths were reported in the state. The case fatality rate is 1.5%, while the positivity rate is 16.86%. So that's the highest daily deaths ever reported in Maharashtra in a single day. Now in Jaunpur, Uttar Pradesh, images of despair and a symbol really of what's taking place in rural India. An elderly man is not allowed to cremate his wife's body in the village, and no one helps him as he tries to take her on a cycle. He finally, as you can see, his cycle falls down and the police step in.
In Jaunpur, Uttar Pradesh, Tilakdhari Singh slumps near his wife Rajkumari's body. Their village didn't allow the COVID victim's funeral. No way out, he put his wife's corpse on his cycle for her funeral by a river. But Tilakdhari couldn't make it alone. The UP police passing by intervened and organized the last rites. By the river, Tilakdhari bid his 50-year-old wife farewell. India's second COVID wave isn't sparing villages. The Prime Minister has voiced fears of the pandemic spreading to rural areas.
And as thousands die of COVID each day in the country, many families of patients who die at home are unable to conduct the last rites. Here's what pandemic heroes Pritham Singh and his colleagues in Delhi, they've stepped up to this, helping collect bodies and conduct the last rites of those who've died at home. Saurabh Shukla reports.
फर्स्ट फ्लोर से उतारनी है, हम दो लोग हैं, सोसाइटी वालों को बोला हेल्प करा दो, वो डर रहे हैं, क्या हमारे घर में बाल बच्चे नहीं है, 73 साल की मदर है मेरी,
दो लोगों से नहीं उठ पाएगी,
दो लोगों से बॉडी कहाँ उठेगी सर, फर्स्ट फ्लोर से नीचे उतारनी है,
तीसरा बंदा चाहिए।
हमारे को ये महसूस होता है कि यहाँ पे किसी आदमी की डेथ नहीं है, इंसानियत की डेथ हुई है, बिल्कुल इंसानियत खत्म हो गई है।
Back-breaking work, heartbreaking scenes. Pritham Singh and Devender in northwest Delhi collecting an elderly man's body for the last rites. 70-year-old A.N. Yadav died of corona last night after failing to find a bed in any hospital. His family is unable to perform the last rites as even his wife has COVID.
कोविड है मैम, घर पे सिर्फ आपकी मदर है, उनके साथ कोई है?
नहीं, अभी तो फिर सिस्टर भी है उनके पास ही।
और मदर सिर्फ अकेले हैं घर पे आपके? मैम क्या बेड नहीं मिल पाया सर को कल?
हाँ, उनको बेड नहीं मिल पाया। हम लोग 2 दिन से परेशान हो रहे थे बेड के लिए।
As Pritham and Devender bring the body down, they have no help from the neighbors.
क्या सोसाइटी में किसी ने लिख के दिया है कि किसी और के घर पे कोरोना से डेथ नहीं होगी? किसी को सर्टिफिकेट मिला है?
Pritham and his team have so far cremated about 322 COVID patients. They don't charge the family. They even use their own ambulance.
हमें ज़्यादा जो कॉल्स आती हैं वो लोग की वो घरों से आती है जो अनक्लेम्ड हैं, जो गवर्नमेंट के किसी भी खाते में नहीं है कि कितनी डेथ्स हो रही हैं। तो हमें वहाँ से कॉल्स ज़्यादा आती है कि जो घर में जाके कोई भी उसकी बॉडी नहीं उठा रहा, ना एम्बुलेंस वाले जा रहे हैं, ना डिपार्टमेंट्स के कोई जा रहा है, ना एमसीडी से जा रहा है, ना किसी हॉस्पिटल से जा रहा है। तो प्रशासन भी इस पर कुछ नहीं कर पा रहा है, तो वो जाके वो बॉडीज हम उठा के क्रिमेशन के लिए लेके आते हैं।
A businessman and a photographer, Preetham and Devender from the NGO United Sikh, also take bodies from Muslim families to cemeteries. This is Preetham's message.
जो हमें गुरु साहब ने सिखाया, हम उसी पच्चीनों पे चलने की कोशिश कर रहे हैं कि मानस जो है अवली अल्लाह नूर पाया कुदरत के सब बंदे, एक नूर ते सब जग उपजया कौन भले को मंदे.
Nobody has seen God, but today in this pandemic, people like Preetham, people like Devender, they are God for those who cannot cremate their own loved ones due to health issues because they cannot. For them, they are no less than a God. In New Delhi with Ashok Mahalle, Saurabh Shukla for NDTV.
Well, to talk more about the COVID crisis and how hospitals are coping, we're now joined by Dr. Deepak Krishnamurthy, Consultant Interventional Cardiologist, Agra Hospitals, Bengaluru, Dr. Sandeep Mishra, Professor Cardiology, AIMS, and we'll also be joined by Dr. Shamsher Dwivedi, Head COVID Task Force, Wim Hunt's Hospital. Well, let's first start with you, Dr. Krishnamurthy. Karnataka reporting the highest ever spike in COVID cases, and this is as the state is under a lockdown. Bengaluru alone accounting for over 22,000 cases. How are you now coping? What measures are being taken?
The government and the BBMP are doing a wonderful job. They are under tremendous pressure, but despite that, they have been requesting all private hospitals to pitch in. We have already given a good number of beds for COVID patients, including ICU beds. The latest request from the BBMP is to give 75% of the beds for COVID patients, including all the ICU beds. Within the hospital, we have created infrastructure to keep the COVID patients segregated and cared for properly. Appropriate manpower is being put in. Doctors from other departments who generally don't treat COVID patients, who generally don't treat medicine cases, including cardiology, nephrology, gastroenterology, neurology, gastroenterology, all the doctors are pitching in and doing COVID duties now to take care of the patients in the ICU, in the wards.
Right.
Vaccination drive is on too.
Right. Dr. Krishnamurthy, is it anything similar to what we're seeing here in Delhi, though now the situation seems to have calmed down, but earlier you had hospitals really desperately seeking out oxygen. Is the oxygen supply anything of a worry for you right now there in Bengaluru?
Oxygen supply has not reached worrying levels as yet. In most of the hospitals which have their own oxygen storage plants, enough supplies are there. Smaller hospitals which depend on cylinder supply do face some issues. But at present, I don't think there is any crisis or shortage happening in Bengaluru.
Right, and the new vaccination drive will begin from Saturday. Is the medical infrastructure, is everything in place for that? Given that now it's going to open up to people over 18 years of age.
Yes, we have been vaccinating the healthcare workers in the first round, and then the above 45 with comorbidities and above 60. The infrastructure is already in place. More places are opening up. The BBMP is also coordinating vaccination drives at apartment complexes and housing societies. Anybody having 50 or 100 and above people can register, and a nearby hospital will arrange vaccination drives. I think this is going to be important to rope in housing societies, apartment complexes where people can get vaccinated nearby home and avoid overcrowding at hospitals. Obviously, everybody above 18 means there will be a huge rush for the vaccine, and the vaccine supplies have to be kept up, and hopefully from May 1st, the supply issues will be sorted out, and when housing societies and apartment complexes, hospitals and more clinics are roped in, we will have a smooth vaccination drive, because apart from masks and social distancing, as we know, vaccination is one thing which is going to bring some control over this pandemic.
Right, though it's not clear right now whether the vaccine drives for this particular phase will be allowed in your housing complexes like they were earlier. Dr. Shamsher Dwivedi also with us. Sir, what is the situation now in Delhi? If you could tell us, earlier we had the situation in which, hospitals were reaching out and sending out SOSs. Has it calmed down slightly?
Yeah, the situation on the oxygen front is slightly better. It is not as desperate as it was few days ago, but again, as I said, that I would like to emphasize that still it is not normal. The supply has not reached the normal requirements that normally the hospitals are having at this point of time. We have doubled up our storage capacity, and we are requesting the supplier to at least fill the storage capacity to its fullest possible extent. But that we are not able to achieve because they still have their distribution priorities. So that shows that we are we haven't optimized, but it is much better than what it was maybe 4 or 5 days ago.
Right, Dr. Sandeep Mishra also there with us. Dr. Mishra, so, given that many across the city are still seeking hospital beds, they're very panicked given this oxygen situation. What is your advice to people dealing with COVID right now in their families? Should they escalate? When do they really need to panic and, seek a hospital bed?
So basically, hospital bed will be required primarily for administering oxygen. And if later on, if requiring intubation, ventilator support, for that purpose, the hospital care will be required. So I think people should monitor their oxygen saturations and also, look at some of the symptoms. If they have increasing cough, if they have breathlessness and confusion, if they see that their lips are getting blue, I think those are the situations where they will definitely require admission. And at that point of time, they should seek the hospital help. Other cases, can be managed well, even at home. Of course, now there are some people who are even managing a little bit more serious patients by oxygen at home. But I think these are the indications. When saturation falls less than 92%, when there is breathlessness, extra coughing, and confusion, cyanosis on the lips, etc. I think these are the warning signs when people should seek hospital help.
Right, but right now it's still such a a fight to get a hospital bed in Delhi. Dr. Dwivedi, if you could, is some effort being made to organize it better, perhaps more coordination with RWAs, with local administration, so that not everybody needs to necessarily come to the hospital for oxygen, and how it can be provided at home?
So the challenge which people are facing is that, as has been explained earlier, that every patient doesn't require hospitalization. But the problem is that when they actually need the hospital, when the saturation is dipping, when they are breathless, they are not getting beds. And that anxiety and these stories makes a person search for hospital bed even before the oxygenation has dipped. Because they feel that when they would actually need the bed, they will not get it, and this anxiety is perhaps adding on to the bed. Like, we have almost doubled our bed strength in this hospital in Wimhans, but understand that whenever you double the bed strength with the same number of staffing, then it is definitely going to affect the quality, and the pressure on the system will be immense. So it is a very, very chaotic situation. The lesson that one has to learn from this medical tsunami is that in future, when this city or our country faces a disaster like this, it could be bio-threat also. So in that situation, there should be a central command and control, and it should not be chaotic. Everybody is fending for himself, herself, no centralized telephone number on which you can seek help. Every hospital, every medical unit with all good intention is behaving in a discoordinated manner. And that is what we have seen in last 7 days. Everybody it was helter-skelter.
Right, it was really just unbelievable, the situation with each hospital reaching out, SOSs running to the High Court. That's not something we expect you doctors to be doing right now, and at the same time a sort of blame game between centre and state, which was very unnecessary at this time when the main issue is to save lives and ensure that people don't die due to lack of oxygen. Well, yes, doctor.
Like when election is declared, the EC takes over. Similarly, when disaster is declared, there has to be a system in place that all power, there has to be a nodal agency which starts functioning automatically. It should not be state versus center versus high court versus lower court versus metropolitan magistrate versus local SDM. This was total chaos. We were totally unprepared, and this was a Pearl Harbor for our country. The way Pearl Harbor was created because of lack of action on the intelligence inputs. When we were watching Bombay, seeing the surge, what were the government of the day was doing in Delhi? Didn't they see it happening in Delhi very soon?
Right, absolutely. Very important points being made there, and this we've heard from many experts of how there needs to be less confusion, a centralized command that takes over in this sort of situation that we've seen. It's just been absolutely desperate, and so many lives have been lost over this last week due to something as basic as lack of oxygen, which couldn't be arranged. Of course, many have said that the sheer numbers were too much for anyone to manage, but it has been over 10 days of this. Thank you so much, doctors, for taking out time and joining us on the show this morning.